Hello, everyone. Happy evening. A very good evening. Uh, a quick note whether the audio visual is all good. Good. Okay. Thank you so much. And first of all, before I start this class, because this is just 1 hour back, and I was waiting for this to thank each one of you personally for helping us reach this 100K subscribers milestone on our YouTube channel. I mean, it's each one of you who has played a significant role, and that means the world to me. Thank you. Thank you so much for that. I am so glad, humbled, and I feel so grateful and blessed to have each one of you. And let me also tell you that with every promotion, with every achievement, it also brings in the responsibility, I mean, the faith that you have in me. So it's my responsibility now to stand up to that and help you in every possible way. So there's a short dedication for each one of you here, and I hope it plays well. So first of all, thank you for all the love and support. And remember, this is just the beginning. There are still miles to go, and together we will grow. And I'm sure you will be there by my side, and likewise here. So just a small contribution. Please let me know whether this plays well and the audio is good. Yes, that was it. And again, thank you so much once again. No audio. Let me see whether this works now. Let me know whether it's good now.
To answer this question, the first thing we have to do. Hello friends.
Hello everyone.
Hello friends. Hello friends.
This is Dr. Nikita here, your mentor, educator and friend.
Welcome back to your very own YouTube channel, Dr. Nikita's Radsynapse.
1, 2, 3.
Yes, thank you so much. And please remember, the journey does not end here. It is just a new beginning, as I said. And I would be looking forward to and seeking all your love, support, and blessings here forth as well. Thank you so much. Right. And now, coming back to our business for today. All right. I hope you can hear me now. Yes. Yes. Thank you so much, everyone. The audio is good. I'm trying to connect. I've connected now. I hope this should be good. Right. Dopamine is a subscriber from 2.6K. That's super awesome. I mean, the beginnings of this journey had been very, very humble. I have planned I've planned a 100K special Q&A session as well. I put it on the Insta and the YouTube community as well. If you have any questions, surprisingly, like all the questions that I was seeing were all related to studies. Guys, ऐसा बिल्कुल नहीं है कि I or you don't have a life beyond studies. You can ask any questions that you want, and I'll come up with a Q&A session soon with this, with the 100K achievement. All right, absolutely. I'll, Pankaj, this video which I shared, it's definitely going to go on the channel and it's going to stay there as a memory forever. Right, so we are gonna post that on the channel and Insta for sure. Chalo. So let's start discussing the today's topic in pharmacology, that is ANS Pharmacology. And here in the session, I'll be focusing on the parasympathetic system. First, the quick basics about the ANS system, the autonomic nervous system, and then we'll be, diving into the cholinergic and the anticholinergic. Let's see how much of it we can cover, because after that, after that at 8 p.m. we have the Unacademy free live class as well, where we'll be continuing ANS from whatever is we are covering. The remaining of it we'll be covering at 8 p.m. It's a free live class. The link has been shared on the Telegram group. And if you're asked to unlock code, you can use the code Dr. Nikita. Okay, you can use the code Dr. Nikita. All right. And starting with the basics of autonomic nervous system. So if one question I ask you that what's the difference between the autonomic nervous system and the somatic system? The difference is basically that there is no ganglia in the somatic system. So remember this point, that somatic system has no ganglia. Autonomic nervous system, it has ganglia. In autonomic, we have sympathetic and we have parasympathetic, right? So if I ask you which is the parasympathetic outflow and which is the sympathetic outflow, which is the parasympathetic outflow? Is it thoracolumbar or is it craniosacral or craniothoracic? Which is the parasympathetic outflow? Right. Logically, understand this point that cracking these exams, especially the MCQ exams, is a lot of smart work as well. Right. You need to apply the knowledge. Whatever you are learning in one subject needs to be applied into the other subject. So there's a parasympathetic. We all know the cranial nerves. We have parasympathetic cranial nerves as well. Which are the parasympathetic cranial nerves? 3, 7, 9, 10, right? Most important, vagus. We have oculomotor, right? They have parasympathetic fibers. So you know that the cranial nerves, they are parasympathetic, some of them. So the outflow is basically craniosacral outflow. You have cranial, you have thoracic, then lumbar and sacral. So the first and last, this is parasympathetic. Thoracolumbar is basically sympathetic outflow, right? Thoracolumbar is basically sympathetic outflow. Now talking about preganglionic and postganglionic fibers in this autonomic nervous system. So you have the ganglia, you have a preganglionic and you have a postganglionic fiber. So parasympathetic versus sympathetic, which one has the preganglionic which is short? Is it sympathetic or parasympathetic system which has preganglionic fibers which are short? Again, the trick to remember here is you don't have to mug up anything. Just try to apply. Now, you must have read in anatomy where you have the vertebra. Then we have the paravertebral sympathetic ganglia are there. The sympathetic chain is there. Paravertebral, right? You have the paravertebral sympathetic chain, absolutely right. So the fibers coming from here, basically, जो आपके spinal cord से आ रहा है, thoracolumbar, these are going on the sympathetic ganglia, right? They are going on the sympathetic ganglia and then going to the effector organs. So basically, what is happening here is for the sympathetic system, the preganglionic is short, the postganglionic is long, right? Opposite is with parasympathetic. Parasympathetic example you can remember as the prototype, which is vagus. So coming from the brain, right from the brain, it is coming and going to all the organs, including the bladder, the bowel, everywhere. So there you have the preganglionic, which is long, and you have the ganglia here. From there, you will have the postganglionic. So most important, remember that sympathetic preganglionic is short, so the postganglionic is long. Opposite is for parasympathetic. Okay, opposite is for parasympathetic. And at all the ganglia, okay, what is the neurotransmitter at all the ganglia? Be it sympathetic, be it parasympathetic, at all the ganglia, it is acetylcholine, right? It is acetylcholine. What receptor is present in the ganglia? The neurotransmitter is acetylcholine. What receptor is present in the ganglia? Right. So remember, all ganglia, be it sympathetic or parasympathetic, it is nicotinic receptor. Acetylcholine is the neurotransmitter. Okay, it is acetylcholine and it is nicotinic NN subtype of receptor. Okay, NN subtype of receptor. Okay. उसके बाद में then you can see this nicotinic receptor, and then you have the postganglionic coming. In the parasympathetic, the postganglionic is also acetylcholine. In the sympathetic, it can be norepinephrine, it can be epinephrine, it can be dopamine, it can be acetylcholine also. Right, let's have a look at that. So look at this one. Parasympathetic, you can see the preganglionic is long, the postganglionic is short. The receptor here is acetylcholine, right? It is acetylcholine is the neurotransmitter. For the sympathetic, basically you have sympathetic adrenergic, norepinephrine. You also have sympathetic cholinergic. Very, very important and a frequently asked question. Remember that sweat glands. Right, the sweat glands are basically sympathetic system innervation, but the neurotransmitter is basically acetylcholine. Very, very important. In the renal vessels, you have dopamine, the D1 receptor, right? We use phenol-dopam vagera. Dopamine has at low dose, it causes renal vasodilatation. So remember, renal vessels is dopamine. Okay, and from the adrenal, you have epinephrine also coming, epinephrine and norepinephrine coming. So basically remember that sympathetic postganglionic can be norepinephrine, it can be epinephrine, dopamine, acetylcholine, while for parasympathetic system, it is acetylcholine. At all the ganglia, it is acetylcholine and it is nicotinic receptor. That is what I want you to remember. Now, this is the same thing that has been mentioned here. Remember sympathetic sweat glands, but it is acetylcholine, which is the neurotransmitter. Very, very important. Okay, very, very important to be remembered. Okay. Now, look at this one. So, acetylcholine is basically the principal neurotransmitter at the neuromuscular junction, the NM type of receptor, as well as all the preganglionic fibers. In parasympathetic, postganglionic is also acetylcholine. In sympathetic, postganglionic is noradrenaline. It can be dopamine, like we said in renal vessel. Acetylcholine in sweat glands, they are sympathetic cholinergic. Okay, remember they are sympathetic cholinergic, or it can be adrenaline, basically from adrenal medulla. Okay, adrenal medulla. Now, this is the difference between the sympathetic and parasympathetic. We said sympathetic is thoracolumbar. This is craniosacral. Short preganglionic sympathetic because you have paravertebral ganglia. Here you have long preganglionic. The ganglia are close to the spinal cord. That is why they are short. This is ganglia are close to the effector organs. Okay. So that is what we need to at least remember for the sympathetic and parasympathetic. Now this is very, very important. Basically understanding what does the parasympathetic system do and what does sympathetic system do. You can, whenever you get confused, you can take resort of this mnemonic basically to help you remember. So the mnemonic here is cholinergic. Okay, remember that cholinergic leads to constriction or it leads to contraction. Okay, so constriction, pupillary constriction, yeah, contraction everywhere. Bowel contraction, bladder contraction. So when these organs are contracting, the outflow is happening. That means it increases the secretions. Adrenergic basically is ADR, is adrenaline, adrenergic, all dilatation and relaxation. So it dilates the pupil and it causes the relaxation. Except sympathetic system is the stimulator for the heart, right, and for the blood vessels. We know that when there is fight, flight, fright system, that is the sympathetic system, the heart rate increases. Right, so basically the heart is stimulated by the sympathetic action. So please write it down somewhere if you want. This will come to your rescue to basically understand the parasympathetic and the sympathetic system. So parasympathetic, that is cholinergic system, and you have sympathetic, that is adrenergic system. So remember that cholinergic, basically it constricts. Cholinergic is CO constricts or it contracts the hollow viscus, and that leads to increase in secretion. Adrenergic is ADR. Okay, the most important here, adrenergic is basically ADR. That means ADR is all dilatation and relaxation. So it leads to pupillary dilatation and relaxation of bladder, bowel. So the secretions basically decrease. Okay. So except for the point, sympathetic stimulates the heart. Okay. So remember that sympathetic stimulates the heart. Pupil में there is mydriasis, that is dilatation. Bronchus में there is dilatation, pupil का dilatation, bronchus का dilatation. GI motility, urine outflow decreases, right? Relaxation होता है. Secretions decrease except the sweating, right? Except the sweating, because sweating is cholinergic वाला, ठीक है? And parasympathetic का उल्टा होगा. Okay, parasympathetic increases the secretions, it leads to pupillary contraction, increased secretions, bronchial contraction, and it depresses the heart. Okay, depresses the heart. So always remember this, you'll be able to solve many questions on ANS, be it in physiology or be it in pharmacology. Okay, cholinergic constricts and contracts. Adrenergic is all dilatation and relaxation. All dilatation is basically bronchodilation also and pupillary dilatation also. Okay, bronchodilation also and pupillary dilatation also. Okay. Now, the other thing that we need to understand is basically that this cholinergic and anticholinergic, that is parasympathetic and sympathetic, is like opposite things in the body. Like in a car, you have an accelerator and you have a brake. So the sympathetic system is like the accelerator, stimulating the heart. Parasympathetic is like decreasing it down like a brake. So when I say parasympathetic, opposite is sympathetic. So for example, let's say that in asthma, what do you want to do in asthma? What drug will you use in asthma? So let's try to decode this. If a patient has asthma, asthma basically means the bronchus is getting constricted. Okay, bronchial airway is getting obstructed. So what do we want to do in the treatment of asthma? We want to do bronchodilation, right? We want to do bronchodilation. So this will make it very easy. If you want to do bronchodilation, which drug will you use? Sympathetic or parasympathetic? Adrenergic, ADR, all dilatation and relaxation. So basically you will use adrenergic wala drug. That is sympathomimetic. Which one? Beta 2 agonist, because beta 2 is the one which is present in the lungs, the bronchi, that will cause the dilatation. So whenever you get confused कि beta blocker use करेंगे कि beta agonist use करेंगे, tell yourself, remind yourself of the mnemonic adrenergic is all dilatation. So we will use agonist. So sympathomimetic. If you are using adrenergic, that is sympathomimetic. So opposite is, what is the opposite? Basically adrenergic हम use कर रहे हैं, तो cholinergic use करेंगे या anticholinergic, which will be equal to sympathomimetic? Will it be cholinergic or will it be anticholinergic? So similar to adrenergic is opposite of parasympathetic, right? That is anticholinergic drugs will be used, right? We will use anticholinergic drugs. Can you tell me which are the anticholinergic drugs which are used in asthma? What receptor blockers and what other drugs which are used? So कौन से receptor होते हैं? M3 receptors, right? M1, M2, M3. M1 stomach, M2 heart, M3 everywhere. M3 blocker will be used. M3 blocker like ipratropium, right? You have tiotropium, you have ipratropium. Those are the drugs which are used in asthma, right? So understand this point कि cholinergic मतलब anti-sympathetic and anticholinergic means sympathetic. So like in asthma we use sympathomimetic and anticholinergic. ठीक है? Now, let's go quickly first understand the basics of ANS, because then only we'll be able to understand the actions and where these drugs are used, and also some important points which I'll tell you ki what where the question is asked frequently. Eye is an important one. Where do you have what receptor in the eye? So basically in the eye, talking about the iris and the ciliary muscle. Okay, talking about the iris and the ciliary muscle. So iris has radial muscle and it has a circular muscle. Okay, so remember that. Again, understand this point. It helps you in physiology also. Iris में we have the radial muscle like this and we have the circular muscle also. When the radial muscle contracts, what does it lead to? Pupillary dilatation or pupillary constriction? When the radial muscle contracts, remember radial DI is dilatation. Remember radial muscle contraction leads to dilatation. Circular muscle contraction, it leads to constriction. Remember C for C. Circular causes constriction and radial causes dilatation. So basically then the radial muscle basically is adrenergic or is it cholinergic if it is causing dilatation? If it is causing dilatation, is it adrenergic or is it cholinergic? Dilatation is adrenergic, right? All dilatation. This circular constriction, that will be cholinergic. So look at this one. Radial muscle has sympathetic innervation. The contraction will basically lead to dilatation. Okay. And the circular muscle causing constriction, it has your M3 receptor. Okay, it has your M3 receptor. Okay, and ciliary muscle is the one which has both. That is your M3 cholinergic also and sympathetic also. So when you will have cholinergic, it contracts the ciliary muscle also. Remember, cholinergic is constriction and contraction. It contracts the ciliary muscle. So when the ciliary muscle is paralyzed, that will lead to cycloplegia. Okay, that will lead to cycloplegia. Okay. Heart में basically sympathetic is stimulating, parasympathetic is decreasing. Okay, parasympathetic is decreasing. Blood vessels, very, very important. What causes contraction and what causes relaxation in the blood vessels? The blood vessels are predominantly sympathetic system innervation. You don't have direct cholinergic innervation. Remember A, B, C, D and the alternate alphabets A and C, B and D. So basically A and C is alpha 1 causes vasoconstriction or it contracts the vessel. Beta 2, B, D, that causes vasodilatation. Very, very important again. Alpha 1 causes vasoconstriction, beta 2 causes dilatation. Remember alpha, A is the first alphabet A1, B is the second alphabet, that is beta 2. So it is alpha 1 and beta 2 causing constriction and dilatation. Another very, very important concept. Okay, another very important concept. Okay. Going to next one, bronchial smooth muscle. All dilatation is adrenergic, it is beta 2 and the contraction is M3. Ulta, the parasympathetic causes contraction everywhere. Right, be it in the bronchi, ciliary muscle, bladder, bowel, everywhere. So remember this as well that you have beta 1 and you have beta 2. Beta 1, we have one heart, so it is heart mein predominant, it is beta 1. Beta 2, we have two lungs. So basically in the bronchi, we will be talking about beta 2. Okay, we will be talking about beta 2. So that's why we use like salbutamol वगैरह जो beta 2 agonist है जो broncho dilatation करेंगे. ठीक है? And you have M3 which is present. Most of the sites is M3. GIT में the smooth muscle walls, relaxation, sphincter contraction. This is your adrenergic sympathomimetic system. Contraction of the wall and relaxation of the sphincter, that is cholinergic system. What happened to this? Where did our slide go? ठीक है, जेनाइटोयूरिनरी में भी सेम, बेसिकली जो कोलिनर्जिक है वो कॉन्ट्रैक्ट करेगा ब्लैडर को और उसके बाद जो ट्राइगोन है that will be relaxed, the sphincter will be relaxed so that the secretion is increased. This is something which is very, very important. Erection and ejaculation. This is frequently tested in the MCQs. Like you'll be asked a question, all of the following are parasympathetic actions or sympathetic actions except. So remember here that erection is parasympathetic action, ejaculation is sympathetic action. How do you remember this? So erection means basically pointing. Okay, the pointing, P for P, it is parasympathetic. Okay, erection is parasympathetic. Ejaculation means the spurt. Okay, the spurt, S is sympathetic action. Okay, so this is frequently asked in the MCQs. You are tested on this. Remember, erection, pointing, parasympathetic. and ejaculation, spurting, that is sympathetic action. ठीक है. Pilomotor smooth muscle, ये basically आपका sympathetic system वाला है. ठीक है. और sweat gland, sympathetic system increases only the sweat secretion. Okay, it increases the sweat secretion, but it is muscarinic receptor. Remember, it is sympathetic cholinergic. Okay, it is sympathetic, but it is cholinergic. So sympathetic system decreases all the secretions except sweat. Okay, except sweat. Okay, everyone is clear with this so far? And another important point here in metabolic functions is, look at this. Kidney में renin release is beta 1. This has been asked in one of the recent exam also, that basically the JG cells, the juxtaglomerular cells, which release the renin, it is beta 1 mediated. Lipolysis in the fat cells adipose, you have beta 3. Okay, it is beta 3. So remember renin. Okay, जो renin वाला है NIN, it's like 1. Renin is 1. It is beta 1. Very, very important. Okay, so give me a quick thumbs up, everyone, if you are clear with the basics of the ANS, the receptors part. Right, so now we will be looking at the drugs, because in ANS, basically most important is when we look at the drugs names, we tend to get confused whether this was cholinergic, anticholinergic, adrenergic, anti-adrenergic. Okay, so look at this. इस पे हम आएंगे बाद में. पहले ये सब हम देख चुके हैं, basically basics discuss किए हैं. Let's see the drugs first. So look at the drugs here, the cholinomimetic drugs. So basically we have the ones which are directly acting and indirectly acting drugs. Now what are directly acting and indirectly acting? Directly acting means they act on the receptors directly. Okay. Indirectly acting means they act by increasing the acetylcholine levels. By themselves they do not act on the receptor, but they increase the acetylcholine levels. How? By inhibiting the acetylcholinesterase. What is the role of acetylcholinesterase? So from the nerve terminal, acetylcholine is released. It acts on the receptors. It is metabolized by acetylcholinesterase. If you inhibit acetylcholinesterase, the acetylcholine levels will increase. Right? Now directly acting acetylcholine. Then you have right. Then you have pilocarpine. Now this is very important. How do you remember that this is cholinergic? Pilocarpine confuse होंगे जब एग्जाम में आएगा कि ये cholinergic है कि anticholinergic है. Remember LOC. Basically ये जो आप drugs देख रहे हो directly acting, either they have acetylcholine का CHOL, right? Like acetylcholine का CHOL, सीधे में या उल्टे में. Now when you see pilocarpine, reverse the COLI. That is choline ka COL. So remember that pilocarpine. Okay, pilocarpine is COL. So this is acetylcholine wala, that is cholinergic drug. Okay. Indirectly acting, basically you have irreversible में organophosphates and carbamates. All your thion, parathion, malathion, or your organophosphate ka fate, phosphate ka FOS. These are organophosphates. Okay, carbamates, it's carbaryl, propoxyl, those are your carbamates. This is very important. Lipid soluble, water soluble. So when you have basically stigmin wale jo drugs hai, another important point to remember that the stigmin wale drugs, they are your acetylcholinesterase inhibitors. You can remember this as stimulate MINS muscarine wala. Okay, it stimulates your muscarine, that is acetylcholine wala. So you know that these are like parasympathetic. Okay, these are cholinergic wale drugs. So lipid soluble, water soluble. Lipid soluble means they will go to the brain. So physostigmin, remember, is lipid soluble. Then you have donepezil, rivastigmin, galantamine. Where are these drugs used? These drugs are used in Alzheimer's. Why? Because what is the neurotransmitter affected in Alzheimer's? It is the decrease in acetylcholine. Remember A for A, Alzheimer's में acetylcholine कम होता है. We want to increase the acetylcholine, so we give these drugs indirectly acting, increasing the acetylcholine. Why do we give these drugs? Because they are lipid soluble and they penetrate the brain. So donepezil, again rivastigmine and galantamine. Water soluble, neostigmine again, pyridostigmine again, and you have edrophonium. Okay, and you have edrophonium. I'll tell you the importance of all of these drugs. Where are they used? So remember, stigmine stimulates muscarine, so they are like cholinergic drugs. Okay, they are cholinergic. Out of these, physostigmine is the one. Physo is friendly and it goes to the brain. Okay, it goes to the brain. Okay. Now let's have again a look at this. So cholinomimetic drugs, direct acting muscarinic receptors, nicotinic receptors, acetylcholine, alkaloids like pilocarpine. Remember the COL. Nicotinic, हमारा NM receptors, NN receptors. Indirect acting, edrophonium, carbamates, organophosphates, including neostigmine. All the stigmine, they are your indirectly acting cholinergic drugs. Now, where are all of these drugs used? Tell me the uses of these drugs. Like, what is the use of edrophonium? What is the use of pyridostigmine? Okay. What is the use of physostigmine? And what is the use of neostigmine? Important ones, what are the uses of each of that? Doctor's diary, how to remember acetylcholine decreases or increases, because now you are reading the drugs which are increasing the acetylcholine are used in the treatment of Alzheimer's. So you know that acetylcholine kam hota hai. You can also remember it as fresh from the farm mnemonic that I can think of right now. Alzheimer's may remember AL. Acetylcholine is low in Alzheimer's. Okay, acetylcholine is low in Alzheimer's. Absolutely right. So remember that edrophonium is short acting. Whatever is short acting is used for diagnosis of myasthenia gravis. Okay, it's used for diagnosis. Pyridostigmine, it helps you get rid of the disease. That means it is used in the treatment of myasthenia gravis. Physostigmine penetrates the brain. So it is used where is physostigmine used? Where is physostigmine used? Last year NEET PG question as well. It is your cholinergic wala drug. So you will use in anticholinergic poisoning, atropa belladonna, that is basically datura poisoning ke treatment mein. Okay, it is used in the treatment of datura poisoning. And neostigmine is used for reversal of skeletal muscle relaxants. Right, it's used there. So remember that edrophonium, phone helps you to remember doctor. DR is doctor, calls up the patient and tells the diagnosis on the phone. So that is doctor calling up and telling the diagnosis that you have myasthenia gravis. So yes, that is also called as tensilon test. Okay, that is also called as tensilon test. So you can remember that gives tension to the patient. एक बार diagnose हो गया myasthenia, so that gives tension to the patient. So remember that is tensilon test. Okay, that is tensilon. ठीक है, clear with everyone? So these are the drugs here. Okay, these are the drugs here. We have seen all of them. Another drug to be added to the list. Acetylcholine dekha, bithanecol dekha, carbachol. Remember cevimelin also. Okay, cevimelin is also your cholinergic drug. Where is cevimelin used? Where is cevimelin used? Remember cevi, S-E, like C-E is S-E. It increases the secretions. When the patient has like dry mouth, in which connective tissue disorder the patient has dry mouth, Sjogren's, right? So Sjogren's may it is used. Cevimelin increases the secretions, and we know that it is cholinergic, which increases the secretions. So you know this is a cholinergic drug. Okay, this is a cholinergic drug. All right. Okay, now let's have a look at this table, the uses. Acetylcholine acts on both muscarinic and nicotinic. Bithanecol, remember BB, bladder bowel में use करते हैं. So post operative ileus होता है, urinary retention होता है. This is a cholinergic drug, so it increases the motility. So it is used in ileus and urinary retention. Methacholine is bronchial hyperreactivity. Pilocarpine, sevimilin, basically they are used in xerostomia, increase the secretions. Pilocarpine, remember P for P, it has an action on the pupil, so used in glaucoma also. Methacholine has an action on the myocardium also. Okay, methacholine is myocardium, pilocarpine is pupil, bethanechol is bladder bowel. So basically remember B, B, M, M and PP. Bethanechol bladder bowel, methacholine myocardium and pilocarpine is pupil. Okay, pilocarpine is pupil. ठीक है. Acetylcholinesterase inhibitors हम देख चुके already. Irreversible are your organophosphates and carbamates. Reversible lipid soluble physostigmine is very important, plus the Alzheimer's drugs. The rest of the three, these are your water soluble: neostigmine, pyridostigmine and edrophonium. Okay, where is edrophonium used? Because it's short acting. Diagnosis, doctor on phone. Physostigmine, why does it enter the CNS? Because it's a tertiary amine used in atropine overdose. Neostigmine, pyridostigmine, myasthenia gravis. Donepezil, rivastigmine, Alzheimer's, enter the brain. Organophosphates are used as insecticides. Okay, they are used as insecticides basically. Now, when you have this very, very important question that how the patient of OPC poisoning basically presents. How does the patient of OPC poisoning present? Dr. Atri, that's a question which has been asked in NICT and I think it's a bit of controversial question. कहाँ आप देखोगे कि बिथानेकॉल दिया हुआ है और कहीं टेम्सिलोसिन दिया हुआ है. OPC poisoning, remember first of all it presents with pupillary constriction or pupillary dilatation. Remember PC, that is pupil constriction. Okay, pupil constriction. O is for, remember, overactive parasympathetic cholinergic system. So basically you know that there will be all parasympathetic effects like diarrhea, urination, meiosis, depressant on the heart, bradycardia, contracts everything, bronchoconstriction, pupillary constriction, all secretions are increased, right? And it leads to CNS stimulation. Okay? So what is the drug that we use in OPC poisoning? What is the drug that we use in the treatment of OPC poisoning? Generally in the question, this will be a farmer because these are used as insecticides. Treatment is, remember, atropine is used because you want anticholinergic. So atropine acts only on muscarinic receptors. Okay, remember it's a blocker for muscarinic only. So atropine is used, anticholinergic is what you can use. Plus for reactivation of the enzyme we use pralidoxim. Okay, we can use pralidoxim. So management is for muscarinic we use atropine, regeneration के लिए pralidoxim. But remember this point that this enzyme organophosphate binding to acetylcholinesterase leads to aging, time dependent. You need to use pralidoxim before the aging because after aging it will not be effective. So this aging is time dependent. So therefore use pralidoxim as soon as possible. Within 24 hours this pralidoxim should be used, right? So look at this. What is happening is acetylcholinesterase, then you have your organophosphate that leads to aging. If you give pralidoxim, okay, this will go away. Okay, this will go away, and acetylcholinesterase will be regenerated. So remember that if there is aging, it is not reversible by pralidoxim. Okay, aging is not reversible, so give before the aging is done. Okay, give before the aging is happening. At what time do you continue the atropine? The signs of atropinization are there. What is the sign? Anticholinergic, मतलब sympathetic होगा. Dilatation of the pupil होगा. Most common sign is pupil getting dilated. Most reliable sign is the secretions getting decreased. Okay, most reliable sign is secretions getting decreased. So remember that oxim, that is your pralidoxim, is used only in organophosphate, not in carbamate poisoning. You have pralidoxim, you have diacetylmonoxim. What is the difference? Pralidoxim is only peripheral action, not in the brain. Diacetylmonoxim is both periphery and brain में वो act करता है, right? So remember, they are used only in organophosphate, not in carbamate. Pralidoxim is peripheral, diacetyl is both periphery and the brain. Okay, so another important point in cholinergic system, what is varenicline? Very, very important. See, as the term says, varenicline. I'm just telling you the important points from all these slides. Varenicline is nicotine-like. Okay, varenicline is nicotine-like. So it's a partial agonist, not antagonist, at nicotinic receptors. So this is used for smoking cessation. Okay, very, very important. It is used for smoking cessation. So because it's like nicotine, so the patient gets the effects like smoking, that is nicotine. Okay, in smoking cessation, of course, we can use nicotine as well. Okay, so this is again a quick revision of this cholinergic system. Bethanechol is used for BB, bladder, bowel, atony. Pilocarpine used in glaucoma, pupil, Sjogren's also. Muscarin, mushroom poisoning में होता है. Muscarin is mushroom. Nicotine, smoking cessation. It can be used as transdermal patch, as gum as well. And varenicline is again smoking cessation, partial agonist at N receptors. Succinylcholine is a muscle relaxant, right? It's a muscle relaxant. Adroponium is short acting. It is used for diagnosis of myasthenia gravis. Neostigmin, reversal of the block. Pyridostigmin, treatment of myasthenia. Physostigmin is atropine poisoning में यूज करते हैं. ठीक है, फाइजोस्टिगमिन यूज करते हैं. और बाकी ये जो आपके ड्रग्स है, गैलेंटामिन, रिवास्टिगमिन, डोनेपेसिल, these are used in Alzheimer's. Okay, these are used in Alzheimer. So these are the various drugs basically that we have seen in the cholinergic system. Okay, and these are the uses of earliest sign we said, Manav, earliest sign like mydriasis. The pupil dilatation. So cholinergic drugs, I hope everybody is clear where all will be used this cholinergic drugs. So you have glaucoma where we use this cholinergic drugs. Sjogren's syndrome because it increases the secretion. Alzheimer's because it increases acetylcholine basically. Paralytic ileus, urinary retention. Belladonna poisoning, that is atropine wala basically. Nicotinic uses, myasthenia gravis, NM, cobra bite also, and reversal of muscle relaxants. These are the various uses of the cholinergic drugs. Okay, भूल जाते हैं ना बार बार, क्लियर है तो आपको सिर्फ बस कुछ चीजें याद रखनी है इसमें. These are the only tricks that you need to keep revising. That if I have to identify a cholinergic drug, I just need to look for COL, right? Like bethanechol, methacholine, pilocarpine. COL उसमें उल्टा है. So remember, pilocarpine is cholinergic. Remember, BB, bethanechol, bladder, bowel, MM, myocardium wala, PP, this acts on pupil. Cevimelin, basically remember, increases the secretion. So again, cholinergic, used in Sjogren's. You have indirectly acting. Remember, the stigmin wale are indirectly acting, stimulating muscarin. Neostigmin, pyridostigmin, physostigmin, all of them. Out of that, the one which enters the brain, that is physostigmin only. And that is why that's the one which is used in your atropine poisoning, right? It is used in atropine poisoning because it enters the brain as well, right? Then remember the DEFG, that is donepezil, edrophonium, and you have galantamine. All of these are basically cholinergic drugs. These are used in they are used in Alzheimer's also. Not edrophonium. Edrophonium is basically doctor phoning, calling up and telling the diagnosis of myasthenia gravis. That gives tension to the patient. So that is tensilon test. Okay, that is tensilon test. So these are the various uses. Or glaucoma में basically these cholinergic drugs are important in angle closure glaucoma, yes or no? स्कॉर्पियन बाइट वगैरह में तो हम वो प्राजोसिन पढ़ते हैं ना, अल्फा 1 ब्लॉकर. glaucoma में in angle closure glaucoma. Okay, glaucoma reminds me that tomorrow 11:30 a.m. we'll do a quick review of the glaucoma drugs. Okay, so that will be your NF100 episode 71. Angle closure glaucoma. Whether you want pupillary dilatation to occur or you want pupillary constriction to occur. What is contraindicated is pupillary dilatation. Why? Because when the pupil will dilate, it will block the angle more. Remember like that. You don't want the pupil to dilate, so you want pupillary constriction. If you want the pupil to constrict, so constriction is done by cholinergic drugs. So yes, we will use cholinergic drugs. And cholinergic basically is anti-sympathetic, right? So anti-sympathetic drugs, you will use your बीटा ब्लॉकर्स अल्फा एगोनिस्ट वो यूज करेंगे. ठीक है, so that's why in glaucoma we use cholinergic drugs. ठीक है, so yes, that was the quick review of the cholinergic system. The rest of it and the details of your cholinergic receptors also, that is what kind of receptor is M1, M2, M3, NM and NN, right? The G protein coupled, all of this, and also the anticholinergic drugs, which is M1 specific. Where are the other anticholinergic के uses क्या है? All of those we'll be discussing in the 8 p.m. class, and we'll try to start the sympathetic system also. ठीक है, sympathetic के basics and the adrenergic system. We will do that in the 8 p.m. Unacademy class as well. All right. So just write down these important points. Try to decode once this ANS pharmacology is done. A few days down the line, we'll have a dedicated quiz on ANS pharmacology also, basically to keep reinforcing the concepts and the mnemonics that we are, that we are learning. Guys, if you can tell me in your sympathetic system, basically what do you find difficult? So that at least I can focus that in the 8 p.m. class and I can help you in the best possible way. What exactly in the adrenergic or anti-adrenergic you find difficult? Is it just remembering the names of the drugs, which is alpha blocker, which is alpha agonist? If yes, I'll simplify that in the 8 p.m. class today on the Unacademy platform. All right. So thank you so much, everyone. And once again, thank you for helping us reach the 100K subscribers mark. And yes, let us keep growing together and keep blessing and keep supporting. Thank you so much. And goodbye. Take care and keep studying, keep revising, and keep winning. Thank you so much. See you at 8 p.m.